Hello, my name is Sabrina McNeil, and the topic of my presentation is on epilepsy. So what is epilepsy? Epilepsy is a disorder of the brain characterized by repeated seizures. A seizure is usually defined as a sudden alteration of behavior due to a temporary change in the electrical functioning of the brain. Normally, the brain continuously generates tiny electrical impulses in an orderly pattern. These impulses travel along neurons, the network of nerve cells in the brain, and throughout the whole body via chemical messengers called neurotransmitters. Seizures are broken down into two groups. You have your primary generalized seizures and your partial seizures. Under each type of seizure, there are some subcategories, but these are the two main broad categories. Primary generalized seizures begin with a widespread electrical discharge that involves both sides of the brain at once. Partial seizures begin with an electrical discharge in one limited area of the brain. Epilepsy affects more than 300,000 children under the age of 15. It also affects more than 570,000 adults over the age of 65 and more than 3 million people in the U.S. and 50 million worldwide. According to the Epilepsy Foundation and Epilepsy Project, epilepsy seizures may be attributed to head injury and genetics. For 76% of people with this disorder, the reason for the seizures is unknown. About 10% of people with epilepsy will have this disorder for their lifetime. It's more prevalent in men than in women, and children and adolescents are more likely to have genetic or unknown origins. Severe head injuries is the main cause in young adults. There are a number of risk factors that may cause epilepsy. They include low birth weight or premature births, lack of oxygen at birth, a seizure in the first month of life, bleeding in the brain, or cerebral palsy. Other risk factors include tumors, infections of the brain like meningitis, mental disabilities, and a family history of seizures. Diagnosis of this disorder includes a review of patients' records, including symptoms and medical history. It also consists of an evaluation that may include the following: neurological exam, blood test, genetic testing. Diagnosis also includes one or more of the following brain imaging tests: your EEG, your CT scan, MRI, fMRI, PET scan, SPET, and neuropsychological tests. Some symptoms of epilepsy include temporary confusion, a staring spell, stiff muscles, uncontrollable jerking movements of the arms and legs, loss of consciousness or awareness, psychological symptoms such as fear, anxiety, or deja vu. Individuals with epilepsy may also have changes in behavior and in some psychosis. They may suffer from depression, anxiety, or suicidal thoughts. The overall intellectual ability of children with epilepsy is comparable to typical children that do not experience seizures. These children may, however, experience deficits in specific areas related to thinking and learning disabilities, particularly in the areas of concentration and attention, memory, organizational skills, and academic achievement, due in part to disruptions in the brain. Children with epilepsy are also twice as likely to be diagnosed with ADHD. Several treatment options for treating epilepsy. They include different medications, surgery. With epilepsy surgery, a surgeon removes the area of the brain that is causing the seizures. You have therapies that are used to stimulate the brain using a device. These include vagus nerve stimulation, deep brain stimulation, and responsive neurostimulation. You also have a ketogenic diet. Some people have found success in reducing seizures with a high-fat, low-carb diet. When you're talking about school implications for individuals with epilepsy, the school staff should be educated on the treatments, seizure first aid, and possible stigma regarding the disorder. The school should have a seizure action plan for any student with this disorder. This plan should include information regarding medication, parent and healthcare providers, and first aid procedures. And school staff should avoid seizure triggers in the school, such as flashing lights. Schools should also provide case management services for students who miss school due to seizures. They should provide special education services if necessary or 504 plans. They should monitor student behaviors to prevent bullying of students with epilepsy. The student for my case study is Timothy. He's age 8. His family background and history include he lives with both parents. There's no family history of seizures. There's no other health or medical concerns. And Timothy suffered a traumatic brain injury at 5 when he fell head first from a jungle gym. And he currently takes medication to prevent seizures. So the referral concerns are Timothy is having several seizures daily. Timothy's seizures are causing him time from class and he is missing instruction. Timothy's grades are beginning to suffer due to lack of instruction, and his current grade in reading is 60% and his math grade is 65%. So my treatment plan for Timothy consists of a 504 plan will be implemented to include the following. Timothy will be allowed extra time to take tests if seizure occurs during testing. Timothy will not be penalized for missed work if arriving to school late due to seizures. Timothy will be provided with extra instruction without penalty to help with missed assignments due to seizures. Timothy will not be penalized for missed days due to seizures. Timothy's teachers, all substitute, school nurse, and other school staff will be made aware of the care that Timothy requires due to his seizures. Timothy's parents should be made aware daily of his seizure activity. He will also have a seizure action plan put in place. This plan provides important information needed by staff to provide care for a student who experiences seizures. This plan should include details of first aid that is needed, parent and healthcare contact information, and any medications that may be needed. So now let's check your knowledge, and these are true false. Number 1, epilepsy is a disorder of the brain characterized by repeated seizures. Number 2, epilepsy is more prevalent in females than males. Number 3, epilepsy is always caused by traumatic brain injuries. Number 4, schools should not have a seizure plan in place for students with epilepsy. And number 5, a ketogenic diet is one method of treatment for individuals with epilepsy. Here are the answers. So number 1 was true. Epilepsy is a disorder of the brain characterized by repeated seizures. Number 2 was false. Epilepsy is more prevalent in males than in females. Number 3 was also false. Epilepsy is also caused by genetic factors and or unknown factors. Number 4 was false. Schools should have a seizure plan in place for students with epilepsy. And number 5 is true. A ketogenic diet is one method of treatment for individuals with epilepsy. Here are some helpful resources and my references.